Aware or please be advised that today's conference is being recorded. If you require any further assistance, please press *0. We'll ask a question after the speaker presentation. Will be Q&A session. I would now like to hand the conference over to your speaker today, Ms. Kate Austin. Thank you. Please go ahead, ma'am.
Thank you for joining us for the COVID-19 media call for July 1st. We will start today's call with a situation report from Health Commissioner Jan Malcolm. Following Commissioner Malcolm, we'll hear from State Epidemiologist and Medical Advisor Dr. Ruth Winfield. After those updates, we will open for questions from reporters on the line. With that, I will now turn it over to Commissioner Malcolm.
Thank you, Kate. Good afternoon, everyone. Thanks for joining us at this different time today. We appreciate your flexibility. Around the world as of this morning, we were above 10.4 million cases of COVID-19 and 511,000 deaths. In the United States, we are now above 2.6 million cases and 127,000 deaths. Here in Minnesota, we are reporting today an additional 426 new cases, bringing our total up to 36,716. This daily increase of 426 was about the same as yesterday's increase, and this was on a testing volume of just under 12,000 tests, bringing our 7-day rolling average test positivity rate to 3.7%, which is up a bit from the 3.3% test positivity rate over the 7-day rolling average from the prior week, but still very, very good in terms of what that says about the control of the epidemic through the testing regime at least. 16.7% was the increase in the total number of tests done week over week, compared to 8% of increases in cases. So we are mentioning these metrics more in recent days, just because it's always important to keep the cases in context of the testing volume. And as we test more, we expect to find more cases. But it's the ratio of increasing cases versus increasing tests that we think is most significant to be aware of. One interesting trend that we've been noting is that the median age of our cases continues to fall as the more recent cases are trending significantly younger. The median age is now at 38.9, which is down almost 2.5 full years in the median age just in the month of June. It's a pretty notable decline in a short period of time. There are 260 patients currently in the hospital, 125 of those in intensive care. This is the lowest level of ICU utilization since the end of April. Sadly, we are reporting 4 additional deaths in Minnesota. All 4 of these deaths were among elderly residents of congregate care facilities, 2 persons in Dakota County, 1 each in Ramsey and St. Louis. I'd like to just make a few comments about the upcoming holiday weekend. It's so important that we take advantage of the opportunity to be outside, be celebrating, be with family and friends, but we really want to reinforce the important message for all of us to stay vigilant about COVID-19 during this holiday weekend. We also want to let you know that we are not going to be holding a briefing call on Friday, so this will be our last planned briefing report for this week. July 4th is often a time to gather with friends and family, and we know how tempting it is to feel like we can go back to normal, especially when we're celebrating. But we need to remind Minnesotans that we need to be in a new normal and to continue to stay vigilant this weekend to protect ourselves and our loved ones, and indeed our entire community. And so we'd like to just continue to reinforce those messages of how good it is and how appropriate it is to celebrate primarily with the people in your own household, the people with whom you spend the most time, and consider doing larger virtual visits with friends and family beyond your household. If you do gather together, keep group sizes limited. And gathering outdoors is a wonderful option. The outdoors is such a better environment in terms of protection from the spread of COVID-19. But even outdoors, it's important to still practice social distancing and to wear masks when you're in close proximity. And absolutely indoors, social distancing is critically important, as is the wearing of masks. And for young adults, remember that you're not invincible and neither are your loved ones. Cases among people as young as their 20s are growing. And if you're visiting bars and restaurants, spread out, wear a mask, carry hand sanitizer with you. And even if you may be statistically less likely to get really sick from COVID, you do risk spreading it to people who are more vulnerable. I'd like to mention a word about health disparities and a connection between COVID and another issue that we frequently talk about in public health, and that is tobacco use. As we've said on many of these calls before, we know that COVID-19 is not affecting all racial and ethnic groups evenly, and that Minnesotans of color and American Indians are bearing a disproportionate burden of sickness and death. Chronic disease disparities contribute to COVID-19 disparities. We want to talk about these disparities related to the use of commercial tobacco products. Many of the same communities disproportionately affected by COVID-19 are also disproportionately affected by commercial tobacco. It's very clear that smoking can compromise the immune system, which makes people at higher risk for severe illness from COVID-19. The CDC, in fact, has just recently underscored that smoking puts people in a higher risk group for severe illness from COVID-19. For decades, we know that the tobacco industry has focused its marketing efforts on children, communities of color, and people who are stressed and struggling. This can lead to addiction and lifelong health conditions that make people more susceptible to a long list of illnesses, now including COVID-19. We just want to remind folks that we at the State Health Department have resources to help people who want to quit smoking or vaping during the pandemic. Free help is available at quitpartnermn.com or the phone number 1-800-QUIT-NOW. With that, I would like to turn it over to our state epidemiologist and medical director, Dr. Ruth Linfield.
Thank you very much, Commissioner. I wanted to update folks on a couple of things today. One, you have heard us talking about conducting a number of prevalence studies. We have just completed a prevalence study in collaboration with the Innovative Courses and the University of Minnesota. This involved leftover plasma samples from 983 blood donors who had made donations between June 8th through the 20th at Memorial Blood Center sites in the Twin Cities metro area in northeastern Minnesota. And overall, the seroprevalence was 1.2%. I'll repeat that, 1.2%. Please be mindful, though, that blood bank donors are not representative of all populations in Minnesota, and we do have some additional studies planned to be able to look at a number of communities and other populations, and we will share those results as we get them. The next thing I wanted to update you on was that we did receive a shipment of remdesivir yesterday. We received a total of 1,680 vials, and as you may remember, if you are doing a 5-day course, it is 6 vials, a 10-day course is 11 vials, and so this would work out to be approximately 280 5-day courses or 152 10-day courses, and typically it ends up somewhere in the middle. 5-day courses are being used more frequently, although the 10-day course is typically used for those individuals who are intubated. Also to let you know that this was our 7th shipment. If you look at the website from the Public Health Emergency Government website that talks about remdesivir shipments, it will say 6 shipments to Minnesota, but that's because the first allocation was broken up into 2 separate shipments. Next, I wanted to give an update on the multi-system inflammatory syndrome in children, also known as MISC. This is something that we've talked about a couple of times, and we now have 13 children who have been reported to the Minnesota Department of Health who meet the criteria for this syndrome. These children developed symptom onset between May 17th and June 19th. As you may recall, this is a syndrome that appears to be associated with COVID-19. However, it may present a number of weeks after the acute symptoms, and sometimes the symptoms are not recognized. Of our 13 cases, 11 of them had evidence of having been infected with SARS-CoV-2 either through PCR or by serology, and 2 were not confirmed by laboratory methods, did have a history of exposure to individuals who were SARS-CoV-2 positive. Of the 13 cases, 77% were male, 8 required care in the intensive care unit. There were no deaths, and the average age was 5. Most of these, 73%, had no prior medical condition. With that, I would like to turn the call over to my colleague, Dr. John Hick, who is a medical advisor for the Minnesota Department of Health and the Homeland Security and Emergency Management Division of the Minnesota Department of Public Safety. He is a faculty emergency physician at Hennepin Healthcare and a professor of emergency medicine at the University of Minnesota. Dr. Hick.
Wow, thanks, Ruth. Can you guys hear me okay? I just want to make sure that I'm off mute.
Yes, John, we can.
Oh, good.
Thanks for joining us.
Yeah, no problem. Thank you for the opportunity, and just a couple things to first reinforce the comments that the commissioner made about the importance of mask use and continuing to socially distance over the July weekend. I don't think it's a surprise to anyone that we are seeing a pretty significant uptick in shootings and other trauma that is occurring. July 4th weekend is always a big weekend for car accidents and other accidents. And so, whether it's fireworks or social distancing or other things, please be careful out there this weekend. It continues to be a very busy trauma center, and we're very grateful that right now COVID is at least on a bit of a plateau, which is a little surprising when you take a look at what is going on nationally, but we're very grateful for that. It wasn't trending that way several weeks ago, and it may trend in the reverse direction and go back up again here in coming weeks. But just wanted to offer a little perspective on what the healthcare systems continue to do, what we continue to do at the state level to try to make sure that we're prepared for any oncoming surges of patients and the uptick in our case volume. As many of you are aware, there are continued shortages of some parts of personal protective equipment. For a long time, we were having trouble getting even simple, face masks and gowns to protect our providers. We are seeing significant improvement in those supply chains and beginning to really try to make sure that our skilled nursing facilities, other assisted living, other long-term care facilities, and more home care providers have access to that personal protective equipment. Very specific types of protective masks, what are referred to as N95 masks, continue to be in significant shortage, but there are some bright spots on the horizon there with some agreements with 3M under the Defense Production Act to be able to provide some additional masks to the states coming directly to the states over the course of the next months and into the fall and winter, which will be very, very helpful. We continue to see some improvement in mask and other supply delivery to the hospitals directly. So our situation there continues to improve somewhat. We continue to plan for increased capacity, both in intensive care units as well as regular medical units at the hospitals, and expanding care at the hospitals to include areas that don't usually provide patient care, including use of staff that don't usually provide inpatient care to try to maximize the potential for hospitalizing patients, if we would have a very large surge of patients. We also are working on the potential for alternate care sites, including a pilot site in Roseville, which is a long-term care facility that was scheduled to be demolished. The state has instead temporarily leased that and is basically using that as a jumping off point for understanding all the logistical and other needs of these alternate care sites that might need to be placed in the community if we would overflow all of our hospital capacity. But our goal is really to keep hospital patients in hospital beds across the state and to move patients from areas that are saturated to areas that are not, which we have already needed to do several patients from a few overloaded facilities to facilities both in the metro as well as in the greater Minnesota area to help unburden those facilities. So really continuing to use that coordination of bed use to try to maximize Minnesota's resources against any continued patient demands is going to be important. I think it's really important to emphasize, too, just the teamwork of the healthcare coalitions statewide. We have 8 different regions in the state that partner healthcare systems with public health, emergency management, and emergency medical services. And regional planning is extremely important in making sure each of the regions is prepared for not only large surges of patients occurring in the region, but also to collaborate on long-term care support, on testing support, really every facet of this pandemic response that touches on all of these disciplines. Also, we need to acknowledge that the healthcare systems continue to share significant knowledge, whether it's through our statewide critical care coordination group and talking about optimizing clinical outcomes, whether implementing, new therapies or providing, different types of care, the University, Mayo, and others engaging in multiple research studies to try to find the best therapies that we can. I think anyone that thinks that we'll find a magic bullet for COVID-19 is probably hoping for a miracle. When we look at our therapies for other viral diseases, there really isn't anything that's curative. We just hope to kind of keep the virus at bay and keep it doing the most damage that we can. And I think remdesivir certainly fits into that category. Dexamethasone has proved to be so far an inexpensive and very effective therapy to add in cases where the person's immune system is overly excited and is causing damage to the body organs rather than appropriately fighting infection. Other antivirals and drugs that modulate the immune system, as well as modulate receptors in the lungs, as well as anticoagulants to keep some of the clotting that's occurring on a large and small scale in some of these patients at bay. All of these things are making a difference now, and as we buy more time with our social distancing and the other measures we put into place, each week that goes by, we learn a little bit more about how to treat these patients more effectively, how to position them, how to ventilate them, how to support them, but hopefully we can keep more of these patients out of intensive care or get them out of intensive care more quickly or get them to survive at the end of the day in better condition than they were 6-8 weeks ago. So I think our outcomes continue to improve. We hope to continue to buy time, to continue to learn, continue to get more robust resources into the state and have some time to continue to do some planning in a non-crisis environment. And we're very grateful to the state of Minnesota through very pragmatic social distancing and other measures, as well as mask use, which we continue to feel is extremely important, preventing disease transmission, as well as from a person who is infected, as well as likely help prevent getting the infection. Those things are going to be even more important, but also better understood moving forward. So the more time we have with this, the better we're getting to know this enemy, and the better able we're going to be to address the needs of any Minnesotan that gets COVID going forward. So that concludes my comments subject to your question. Thank you.
Thank you, Dr. Hick. As we open it up for questions, we ask that reporters limit themselves to one primary and one follow-up question, and that we limit the number of questions from each outlet so we can get to as many as possible. With that, operator, we are ready to take questions.
At this time, I would like to remind everyone, in order to ask a question, press star, then the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster.
I tried it.
Your first question comes from the line of Ms. Catherine Richards from Minnesota Public RAD. Your line is open, ma'am.
Sure. So we continue to hear about people being charged for their COVID-19 tests, and more specifically in the last week, reports that their insurers are telling them that they will not cover the test if they're asymptomatic. And yet we're hearing from the state that if you're asymptomatic, you should get tested and it shouldn't cost you anything. And so I'm just wondering how those two things can be true at the same time.
Hi, this is Commissioner Malcolm. Thank you, Catherine. Yes, we are very much aware that this is still an issue. We absolutely want people to get tested when they need to get tested, and the recommendations are absolutely that anyone who has symptoms and people that don't have symptoms, but are, especially those who are told by public health workers that they had close contact with someone known to have COVID-19 or are connected to an ongoing outbreak. We really want those folks to get tested. We do have more testing capacity now. We know it can fluctuate from day to day at specific clinics. So it's always good to check that testing location finder. But to your question of billing, that does continue to be a work in progress. The state has every intention of making sure that cost is not a barrier to getting these tests that are so very important, both for individual patient care, but also for understanding what's happening with the disease in the community. We're looking into these questions. We're in dialogue with the insurers on the questions of asymptomatic testing. If people feel that they have been billed for a test they thought should be free, they can file complaints either with the state health department or the state commerce department. So we are, I just going to say I apologize for the confusion and the frustration. We're trying to work through to prevent those issues on the front end, but people are free to file complaints with the health department or the commerce department.
Sure, but I guess I'm just wondering, like, what's the issue? Because up until this point, we've been told that testing should be free. Why aren't the plans covering these tests as they said they would?
I think, Catherine, the issue turns around the difference between what the plans consider to be testing related to care and whether that should be only restricted to symptomatic individuals or whether they should be responsible for covering asymptomatic individuals. We certainly want to encourage them to take that more inclusive strategy that is in the community's interest and in everyone's interest to catch problems early and to try to understand this disease at the community level. But the the question of coverage for asymptomatic testing is a little bit more of a recent problem, as the guidance has expanded to include asymptomatic testing, but it is very much the state's commitment to work those things through and to make sure cost is not a barrier.
Your next question comes from the line of Kirsty Marone from MN Public Radio. Your line is open.
Thank you. Can you hear me okay?
Yes.
Okay, thank you. I wanted to ask about the case of the bar in St. Cloud that's been linked to, I think, almost 50 positive cases. Most of them are young people. My understanding is that bar has closed voluntarily, but I wonder if you think that bar owners are doing enough to encourage or require social distancing. And I know the governor said he might shut down bars if this continues, either individually or like a statewide shutdown. What's sort of like the tipping point for that decision?
Well, I think this is Commissioner Malcolm, and if Dr. Linfield has any more current information on the specific situation, I'd invite her to comment. But your broader question, there have been a lot of conversations with leaders in the hospitality industry, with the folks particularly representing the restaurant and bar industry. They are very aware of how important this is. They've been sending messages out to their members, strongly exhorting them to be aware of the executive order and of the rules, to make sure they're following them. And we've really had good cooperation with sort of the leaders of the sector to try to get those messages out. Just today, I think we sent out some material that collateral that establishments can use just to continue to publicize the rules and make it clear what those rules are. And we're also having conversations about how do we make sure that we've got the kind of the appropriate steps in place to take enforcement action when that is needed, including making it really clear to the bar and restaurant owners what the consequences for continued violation of the executive order are, which could include shutting down a facility. So we're at this point we're focused on enforcement actions at the individual level and on a really, I hope, aggressive and effective communication campaign to the public as well as to the owners of these establishments, because the public really needs to understand that these are not just suggestions, these are rules and they need to be followed.
Is there anything more you can say about this particular case, whether this was a situation where they weren't following the rules, or, I mean, is it just really difficult in a bar type situation to get people to social distance and wear masks?
I think there are challenges in the environment, but that's why the guidance is so specific about, bars needing to have people seated and not just standing around the 6 feet of distancing and the like. But Dr. Linfield, I don't know if you have any more specifics on the individual case, but in general, I think it's just safe to say that we recognize that it's a challenging environment.
Yeah, I would agree. This is Ruth. We have now had over 300 cases associated with bars, and it isn't just in St. Cloud. We have had cases associated with bars in other parts of Minnesota, including the Metro and including Mankato, and it is, as the commissioner says, it is a challenging environment. And so the message really is that people need to take this seriously. They should go in small groups. The safest thing is to be with your household, but go with a small group if you're going to meet some friends. Wear a mask when you're not drinking, seated. We have to ensure that people are separated, and we are working with the hospitality industry, but we need to work with the public too. Please take this seriously. We are aware that there has been transmission from people who've attended bars to their families, including families who have had severe disease. So please take it seriously. Thank you.
Thank you.
Your next question comes from the line of Mr. Joe Carlson from the Star Tribune. Your line is open, sir.
Hi, thanks for taking the question. Can you hear me okay?
Yes.
Okay, great. I'm just wondering, what is your advice to the governor as he considers whether to require people to wear masks in public through an executive order?
I can tell you that that's been a vigorous conversation within the executive branch and with the governor directly, and I think he's listening, and it is our advice from the health department's perspective that that this is so important and so effective, and the evidence has gotten more and more clear on this point that we do recommend that it become a requirement at the statewide level. Many cities have taken that action. We think it's prudent, protective policy statewide. So that's been our recommendation, and I know that the governor is seriously considering it. He has said repeatedly, he knows that for this to work, Minnesotans have to buy in and have to really understand the value of doing these things, and you can't always just mandate your way to that. But he is very seriously considering our recommendation.
And I guess related to that, what is your advice? Should Minnesotans go to 4th of July parties this weekend? Because what I hear is a lot of things about considerations if you do go. But I'm wondering, should people go?
Well, we think, as we've said before, the outdoors is a much, much safer environment, and that certainly this holiday lends itself to outdoor celebrations. But we just encourage people to be mindful of whatever gathering they're doing, preferentially outdoors, but even so, to be mindful of avoiding close congregation in large crowds, keeping a distance. But we are, I think, very mindful of the fact that it's an important holiday. It's summer. People are eager for those social connections. And we just want to remind people that this virus is very much with us, and there are practical things you can do to reduce your risk and the risk to other people.
Great, thank
you. Your next question comes from the line of Ms. Clarissa Baker from St. Cloud Times. Your line is open, ma'am.
Hi, thanks. Yeah, I was wondering if there's a particular threshold for when the state might release information about outbreaks, linked to certain businesses.
Yes, Ruth, you can certainly comment on this as well. It's certainly an important tool that public health uses to let people know about specific environments when there is an ongoing risk to public health. So if we can establish that a business is the source of a cluster, we certainly, first of all, work with that business and inform them of the situation and inform them that this will become public information. In terms of what is the threshold in terms of number of cases required for that to be true, I think that may depend on the circumstance. But Ruth, do you have anything to add there?
Yeah, so that is something that we are actively looking at. It depends on a number of factors, as the commissioner was describing. And what we're also finding with bars is, and I presume that's why you're asking, is that many of these young people go to multiple bars. And so it takes a little additional effort to find out what the circumstances are at the specific establishment. We are now reviewing the data and discussing this very issue.
Okay, thank you.
Your next question comes from the line of Miss Catherine Richard from Minnesota Public Radio. Your line is open.
Wow, I never get more than one call in or question in. This is great. So I wanted to go back to the cost issue again. Sorry to beat this drum here, but Commissioner Malcolm, you mentioned that this should not be a barrier for people seeking testing. You don't want cost to be a barrier. I mean, aside from the plan just taking care of that cost, are there other solutions that you are considering to make sure that people aren't paying hundreds of dollars for a test if they're asymptomatic?
Well, that's part of why we've stood up some of the community testing that we've done in certain specific communities around certain circumstances, whether they're known workplace-related clusters or outbreaks or large amounts of community spread in some of our rural communities. The 4 community testing sites we had up for the last few weeks following the mass gatherings. So we've attempted to make community-based approaches like that accessible where we know there's a need. Your question is a very good one, though. It's really a broader systemic question about who should be responsible for what going forward to make sure that the testing is there and is getting accessed and appropriately used. And clearly we do have some work to do to work through what is the long-term strategy to make sure that cost isn't a barrier. We also, are aware and grateful for the fact that CVS, and it might be true for Walmart as well, I'm not sure, but CVS advertises no billing policy for the testing that they administer. I think that is, I believe, strictly PCR testing at this time. I don't know if it's here. Maybe know more details than I do, but so there are other resources coming online to supplement the types of kind of testing delivery systems, if you will, that we are reliant on today. And we look forward to more of that, more testing options being more easily available to people. But this cost question and a payment question is a very fair one. And as I mentioned, we're in dialogue with the insurers right now about how to think about asymptomatic versus symptomatic and the need for, if testing's going to work, it's got to be, it's not just a one and done sort of thing.
Okay, thank you.
Your next question comes from the line of Ms. Kirsty Maron from MN Public Radio. Your line is open.
Thank you for the chance to ask one more here. We have had a few listeners asking about flights, especially as people feel more empowered to do more traveling. Wondering about whether social distancing is being followed. Some people have reported being on flights with all the seats filled, and wondering if you have any special guidance, for airports and people as they're flying, and also should they be self-quarantining after travel?
Oh, those are great questions, and I would invite Ruth's perspective, Dr. Hick, if he's still on the line. I think as a general rule, we're aware that the airline industry has been working on how to be able to return to operations in a safe manner. I have personally haven't been on an airplane in a very long time. I think it's another situation where people need to make careful decisions about their own risk and their own risk tolerance as to when and whether they want to travel by air. But certainly, I think what's recommended is much more spacing and not full flights. I've not heard of instances of that myself, but perhaps others have. Sounds like you're aware of travelers who report that, but that certainly would not be the best health advice. But Ruth or John, anything else you'd like to add?
Well, what I would like to add is also that people should be mindful of where they are traveling and whether they have a plan of what to do should they develop symptoms. And certainly they should be very careful about good hand hygiene, wiping down surfaces. They should be wearing masks. They should be careful about the type of travel that they do and not, limiting exposure to crowds, etc. So, really using a lot of the precautions that we've been talking about for a long time. And, as the commissioner said, it needs to be an individual risk-benefit calculation.
And I'll just tag on to what Ruth is saying. I think there's a lot of considerations, not just about the flight itself, but just what is the need to travel to the destination? What's the current case situation at the destination? How much exposure will you have there? Are you having to use public transport? Even if you're using, rideshare or other, activities, there's just sort of multiple, thresholds that you have to think about with exposure, that if you're with an Uber driver that is, transporting many people a day, I almost said patients, but, transporting many people a day, your exposure is not necessarily that one individual. So the planes themselves, I think there's been some significant progress made by a number of air carriers, including Delta, with their disinfection procedures, the HEPA filtration of onboard air. Disappointing to see that American is not going to leave, open seats apparently anymore starting soon. But no question, we're seeing an uptick in air travel. And I think some of that does reflect, if you're wearing a mask and you actually, if the air is HEPA filtered, it's probably better to have your air vents on, rather than off. Just make sure that you, wipe down surfaces. If you have any concern about those, being touched, wear a mask at all times. Consider a face shield. The protective effects of face shields are very significant with or without a mask. They add a significant layer of protection, even though they're not the most fashionable thing, to wear. They do offer significant protection. So I think, as was said, there is a risk-benefit calculus anytime we travel, but even more so now. Where are you going? Why do you need to go? What are your plans when you get there? And what are the precautions you're going to take on board? But the air carriers, I think, have done some really good things in trying to keep, the flying public safe. And that's great, especially for when you do have, a need to, visit, whether it's an ill family member or, for other reasons, when you must travel, you can, be assured that you are traveling more safely than even, perhaps 3 to 4 months ago.
Thank you. Operator, we have time for one more question.
Yes, ma'am. So the last question comes from the line of Mr. Joe Carlson from the Star Tribune. Your line's open, sir.
Great, thank you for taking this additional question. I have a question about the Prevalence Study. If I understood right, the number was 1.2%. Can you tell me, what does that number mean to you? How does it compare to your hypothesis? And can you draw anything from a seroprevalence of 1.2% in this community?
Thank you for the question. What it means to me is that, and again, these were donors from June. So amongst this group of donors, there were very few that were infected with SARS-CoV-2 or had COVID-19. I might have expected it to be a little bit more, but 1.2% for a group of healthy adults, it certainly is plausible. I suspect it, we are, as I mentioned, we are doing these additional seroprevalence studies, and as we do other groups and other communities who may have had more exposure to the virus, I think we will see an increase in the number. So I think that it is great that there have been people who have been uninfected. It also means that we have a large population of people that are at risk. And so until we get an effective vaccine, we have to do everything we can to protect people from getting infected. Does that help?
So that would be, yeah. So, I mean, it sounds like the thought is the 1.2% is pretty low, and that means there's quite a few more people that would have to get the disease before.
Oh, yes. To have what we call herd immunity, you know, we'd like to see it more as 60-70%. So we have a long way to get to herd immunity. And the other thing that's challenging, and we talked about this in the past on these calls, we don't know enough about protective immunity, and we don't know enough about how long it lasts. With this particular virus, we think it is not going to be as long-lasting as something like measles, which you have lifetime immunity. Here, based on some initial data and based on similar coronaviruses, the immunity may last for a period of months to a couple of years. And so we will have to learn more about this. But it does mean, unfortunately, that this virus is going to be with us for a while. And therefore, we have to, I know everybody is sick and tired of all the prevention measures, and they want to get back to normal life, but it's going to be a while.
Yes, that's true.
Great, thank you much.
Thank you.
That's all the time we have this afternoon. Thank you to our speakers and the reporters on the call. If you had a question we weren't able to address today during the call, please feel free to reach out to our office. Have a good day, and we'll talk again soon. Thank you.
Ladies and gentlemen,
that was state health leaders discussing their ongoing response to COVID-19 in Minnesota.